Hello, this is Gary Crowley with DoItYourselfJointPainRelief.com, and this is video 3 of 3 for lower right side back pain relief. And in the first video we showed you how to release basically the upper half of the right side of your pelvis, or your hips back here. And in video 2 we showed you how to release the inside of your pelvis, a muscle called your iliacus. And between doing both of those, hopefully you've actually already experienced a lot of back pain relief on that lower right side. If that's not the case, or even if it is, it's good to do this third technique, because we're going to release the opposite outer third of your quad and this IT band, because in my experience a lot of times pain over here on that lower right side is caused by these being tight and basically yanking across your pelvis and basically making this side hurt. So all we're going to do here is we're going to do the basic, we're going to do a press pull release technique, which I show you on my techniques page, how to do all these in these very short videos. But I'll also show you here, but feel free to visit the techniques page if you have any questions. But basically all we're going to do is you're going to take your fingertips and you're going to press in this outer, basically this outer third of your quad and the side of your leg. And you're just going to press with your fingertips and notice any tender spots. And if you have any back pain at all, usually these are pretty tight because they're kind of torquing your pelvis and making your poor low back muscles be in a tug-of-war with muscles that are quite frankly just bigger and stronger. And so your low back muscles have to kind of seize and then you experience pain, but usually it's all these big strong muscles down here that are doing it. So you press along here, notice any tender spots. We're just going to investigate here, see what's tender, what isn't. And basically, you know, healthy tissue doesn't hurt when you press on it. So you can skip all the areas that aren't tender, if there are any, but when you find a nice tender spot, we're going to do a press pull release. I'm going to have you press your fingertips into that tender spot and then pull on it and then release and press back into it and pull, release, press back into it, pull, release. And again, we're not massaging it. Massaging it isn't going to get it done. You're going to press on a tender spot, pull and release. And I'm also using what I call the hand-on-hand technique, where I get my fingertips in there and then I take the palm of my hand, I press on my fingertips, and that allows a lot of pressure in an easy way to get on that tissue. So you do that and you just be patient. You don't have to torture yourself. You just press at the level you can relax into. And when that lets go a bit or lets go entirely, you can move up to another spot, work on that for a little bit. Then move on up, and you go revisit that tender, that stubborn spot, because now that other things have released, it'll probably help that stubborn spot release. And you're just going to go up your whole quad, and then for some reason I go up on my quad, and then I go down on the side of my leg. I don't know, it's just what I do. I could very easily just go up the side of my leg, just so we're clear, and I could move down my thigh. But now you can also get your thumbs in there, which is also a good way to do that press, pull, release, press, pull, release. And that'll help the tissue and release. And then sometimes you can even, if you put your leg, if you kind of hang your leg over a table or something, I like to stick a little something under my leg just to give it a little angle. You can do what we call a press hold move. Again, which is on the techniques page, but I'm basically doing a hand-on-hand to apply the pressure, and then I just flex my leg back and forth and make that muscle move under the tissue that I'm pressing on. Again, I'm never massaging it because that makes you feel good and stuff, but it doesn't do what we're looking for. And after you've done a pretty good job of releasing a lot of this, you might not get it all, but you take a moment and then just do a self-assessment. Notice how that lower back feels, and I will tell you, sometimes this can just be the magic button to entirely release your lower back. If I'm bored at a party and someone tells me they have lower right side back pain, then sometimes I'll just dig my thumbs in their outer quad and their IT band for just literally, 30 seconds or a minute, and I'll ask them how their back feels, and a lot of times they go, wow, that's a lot better. So it's a good party trick too. So once you do that, and you feel like you've done a good job on that, it's always good to come over to the other side and just make sure. Now, it probably won't be as tight as this, but you never know, it might be. And if there's any tender spots, just take a minute, try and release them. And especially, if you still got some stuff going on here. And then again, self-assess, notice if it's better or not. And lastly, if after doing all 3 of these videos, you still have some lower right side back pain, then I do encourage you to visit my main lower back pain relief page, where I give you a whole bunch of other things you can do to relieve your lower back pain. And it's usually a couple things that are causing your low back pain, but it's usually not your low back. So rubbing on your low back usually doesn't do it. It's usually your hamstrings or your glutes or your vastus lateralis or your IT band or your iliacus or your psoas or any of these muscles that you may not even know, but I show you how to work on them. I show you how to release them so you can be empowered to fix your own pain. So I do thank you for your time, and I do hope to hear how it goes. And again, if this didn't do everything for you, then head over to the lower back pain relief page, the main one, and I'll show you some more things to do. Thanks for your time. I do appreciate it.